got a recording of this on
Okay.
our pro site, so pro.blister-prevention.com.
Yep.
Under office hours, so you'll find it there.
Okay, cool.
Anytime you miss out on the live thing.
Okay, cool.
So let me just make sure I've got everything going on here. Hey, Carmela, how are you?
Yeah, good.
Pretty good. How are you?
Yeah, not bad. Now I'll share my tab. Alrighty. Okay, you guys can see my screen, my slides.
Yes.
Yep.
All right, well, this is a big one today, so I'm going to try and race through it, and we might just get started now. So, yeah, I just want to go through sock fibres because it's something that I've been looking at relatively closely lately with the paper that Doug and I published, and we are stocking some Injinji toe socks on the Blister Prevention shop. And yeah, it was quite eye-opening looking through all their range and sort of selecting our own range. Now, hang on. I can't change the slide, so I need to put that over there. Here we go. So we're going to be looking at, you know, the obvious question that everyone asks us, what is the perfect sock for blister prevention? Is there one? What are its properties? Because, you know, we need to be able to identify it clearly in the shoe shop. We're going to look closely at cotton, wool, and CoolMax fibres. What is moisture wicking? Does it actually happen in shoe? And is it the main thing in preventing blisters? Moisture management. When we think about socks and how they prevent blisters, we assume that it's the way that they deal with moisture. So there is moisture coming from the skin, that is sweat, that gets to the outside surface of the skin. It interacts with the sock. It moves through the sock potentially, and then it evaporates into the outside environment. However, it's important to realize that those arrows, where it's evaporating to the outside, that's to the in-shoe environment. Then it actually has to get through to the outside environment. So there's quite a lot that's got to happen for, you know, moisture wicking to actually occur. When we are thinking about how moisture wicking works at preventing blisters, we are basically saying that we are implementing a coefficient of friction reduction strategy. So we're trying to keep the skin dry, because we know that very dry skin has a low friction level compared to moist skin. And that makes it more slippery. The whole aim of blister prevention is to allow, as the bones are moving back and forth within the foot, the skin is usually staying still. So the bones are moving back relative to the skin. We want the skin to be able to move in sync with the bone at an earlier point. That reduces the shear deformation. When it comes to moisture management, we instantly think of hydrophilic and hydrophobic. So we all know that cotton is a hydrophilic fibre. It holds moisture. And CoolMax is a hydrophobic material. It repels water. And interestingly, wool is a bit of both. So it's quite a paradox, wool, and potentially to its favour. Just trying to get a little bit technical for a moment. With regard to how sock fibres interact with moisture, there's absorption and adsorption. So absorption is the amount that is absorbed like into the actual material, and adsorption is kind of like how the surface fibre reacts to the water molecules. So hydrophilic materials will really hold that moisture against, like on the surface of the fibre, whereas hydrophobic will just let it move easily. It won't hold on to it. Having a look at some fibres, there's 4 wools: coarse wool, fine wool, alpaca, cashmere. Wool is characterised by these scales. That's different to most other fibres. and on the end is polyester, so it's a synthetic. It's very smooth and kind of symmetrical. And cotton is a twisty fiber, and if in cross section, it actually kind of is a big sort of U shape and has a lumen, which is like an airspace that is very skinny but has the potential to really expand. And here's an example of it. So you can see this one's cotton, top left is cotton. See these U-shaped fibers, and you can see, like in this one, there's a lumen. There's this dark bit in the middle. That's like an airspace. So that's where the moisture gets absorbed into. Wool, on the other hand, is oval or round. And in cross section, you don't actually see the scales so much. Looking at cotton, wool, and CoolMax, all on the one slide here. Oops. Here, this is like a cross section of the cotton. So see that dark bit in the middle? That's like an airspace. And you can imagine if there's something that wants to get in there, it'll just expand massively to hold quite a lot of water. The wool is characterized by the scales. It kind of has this, or some of them have this lumen, or sorry, this medulla in the middle. That is something that can hold a lot of water, but also water can be absorbed in between all those little cells as well. And this one is CoolMax. This is the synthetic fiber that kind of is like a circle but pinched in at both ends. Here's another kind of nice photo. Cotton here with the lumen, wool with the scales, nylon, very symmetrical and round, and acrylic and spandex, another synthetic fiber that's quite symmetrical and smooth. So let's have a look a little bit deeper at specific fibers. I've got this one for CoolMax. It's a good cross section. These are the materials or fibers I think are used more in clothing rather than socks, but I just liked to show you like the difference and the possibilities. So that's the characteristic shape of the CoolMax sock fiber. So yeah, it's this scalloped oval cross-sectional fiber geometry, so it increases the surface area by 20%. So whatever way it interacts with water, it does it 20% more because there's 20% more surface area. CoolMax fibers are hydrophobic, so they repel water. So water will basically just kind of sit on the surface there and is very happy to move back and forth. There's nothing keeping it stuck to that same spot. It doesn't know whether we want it to move to the left or to the right along its fiber. So you have to realize that the reason it moves is presumably where there's a moisture gradient. So it's going to move from an area of high moisture content to an area of low moisture content. That's important to remember. So it's hydrophobic. We've got that increased surface area and moisture gradient. That was just in case I forgot to mention those things. Cotton, what do we know? It's a hydrophilic fiber. It holds a lot of water and therefore it inhibits moisture wicking. Here's the cotton fibers in cross section. Cotton fibers absorb 3 times the moisture of synthetic acrylic fibers. Once it's wet, cotton has a 10-fold greater drying time compared to synthetics. And obviously this is in opposition to the synthetics, which allow the moisture just to move along its fibers. So on the one end, you've got cotton. On the other end, you've got CoolMax. They're kind of in opposition to one another.
What about bamboo?
Don't know about bamboo. I would assume that it's even more like cotton because we know that the drying time for bamboo is just like ridiculous almost. Like it's hard to get bamboo socks dry. So in terms of absorption, you would assume that it absorbs a lot, but no one has done any work that I've heard of in terms of what it means for blister prevention. The way I think about it is it can't be good because it holds on to so much water. But that was when, you know, I was thinking that hydrophilic is bad, hydrophobic is good. But the way Doug Ritchie's kind of thinking about it now is he thinks that wool is possibly the best fiber because it is the combination of hydrophilic and hydrophobic. So it will be interesting to see what happens with bamboos. Definitely some work to be done there.
Okay.
In terms of wool, we know that it is this paradoxical fibre. It's hydrophilic and hydrophobic. And here's our wool structure again on bottom left. It's sort of round or oval. Some of them have this medulla. So this is like an air space, but there's also air spaces between these cells. The only wool fibres that have this medulla are the coarse wool fibres. So if absorbing moisture, which you'll see in a moment, seems to be a good property of wool, if that is an advantage, then we would be using coarse wool in sock manufacture. In fact, generally, merino wool is used, and merino wool is a relatively fine micron size, around about 19 to 21 microns, whereas the coarser wools, like your 29 microns, they potentially handle moisture a bit better in terms of absorption. And also, yeah, there's more air pockets, and air pockets are good because it aids water transportation. So this is how wool can be good in terms of moisture management. When we're looking at sock research and fibre research, there's a few things that tend to get looked at. One is moisture regain. That's describes the ability of the sock material to attract and hold on to moisture. In terms of overall moisture regain, wool is the most hygroscopic. Hygroscopic just means the combination of absorption and adsorption. So wool holds the most moisture. So it's kind of tricky that we think that how can wool be good? Because we know that or intuitively know, we've been told all these years that moisture wicking is good because it doesn't hold moisture. Cotton is bad because it holds moisture. And yet we've got these studies and I guess sort of theoretical ways of thinking about how wool works is that it's good that it holds on to water. So wool holds the most water due to absorption and adsorption. Cotton is the next most hygroscopic, so it holds the next most amount of moisture, and that is 3 times that of acrylic and 14 times that of CoolMax. Swelling is another thing they look at. The absorption of water will cause swelling of the sock fibres. This reduces airspace within the sock, and therefore it inhibits the movement of moisture away from the skin surface. So swelling is seen as a bad thing because it gets rid of all the air pockets, and the air spaces can aid in moisture transport. Cotton fibres will increase volume and swell by 44 to 49% when immersed in water. So just think back to that lumen in the cotton fibre. It's flat and it doesn't take up much space, but it has the ability to fill with water and really swell that cotton fibre. Another study found that when moisture is applied, cotton fibres swell 45%, wool fibres 35%, and acrylic 5%. Moisture wicking, obviously we look at that a lot too. We need that moisture gradient. Moisture is going to move from an area of high moisture to low moisture. Rossi studied the moisture storage and moisture movement properties of 3 common sock fibre materials. Polypropylene showed the best capacity to wick moisture from the inside of the sock to the outside. The next best was woolen socks, and the next best after that was nylon. So nylon, which is present in just about every sock to some degree, that showed minimal wicking capacity with large amounts of moisture retained on the inner side of the sock. So nylon isn't used for moisture wicking. It's used to add kind of stretchability and durability to the sock. But some socks have quite a lot of nylon in them. Density and construction. So socks can be categorized by their thickness and their construction technique. The density of fibres or construction of the sock can influence moisture wicking capacity. So the denser the weave pattern or the thicker the padding, this may enhance moisture movement through the sock by reducing compaction and preserving that airspace between the fibre networks. So we are thinking that thicker socks are better than thin socks, or at least socks that don't compact. And the reason we think this is thanks to the work of Herring and Ritchie. Back in the 1990s, they did these 2 studies in terms of blister incidence and different sock materials and construction. So they looked at 35 long distance runners and compared blister incidence in padded socks of identical construction but different materials. They were either 100% cotton or 100% acrylic socks. And in this study, they were both thick. There's a follow-up study where they were both thin. So in this study where they were both thick, there were twice as many blisters with the cotton socks, and those blisters were 3 times the size. So this suggested that the acrylic fibres were beneficial over the cotton fibres in the athletic socks. And the authors proposed that the results were explained by lower friction force on the skin surface due to superior moisture management of the acrylic fibres. So that's a reasonable thing to assume. This is another way of saying that last sentence. We assume that the acrylic fibres dealt with the moisture better. It moved the moisture away from the skin, keeping the skin drier and therefore more slippery, such that it can move in sync with the bone at an earlier point in time for those runners that were, doing their thing with their long distance running. However, in their follow-up study, Herring and Ritchie found no difference in blister frequency when comparing the 100% cotton to the 100% acrylic socks. But this time, remember, the socks were thin. So when the socks were thin, the benefit of acrylic over cotton was lost. So they speculated that the thick, densely padded construction enhanced wicking capacity, which is a reasonable thing to assume. However, alternatively, it could be that the socks reduced pressure. So because they were padded, they reduced peak pressure. And they can also potentially absorb a bit of shear. And another way of saying that is this. So socks can also, when they're thick, they reduce pressure because they're a bit thicker and therefore they cushion, and that reduces peak pressure. And thick materials and cushion materials, they generally undergo a little bit of shear within the material itself, which means there's less shear that has to happen within the skin. So the question is, do socks really reduce plantar pressure? Well, yes, they do. So Howarth and Rome studied the plantar shock attenuation provided over 72 hours in 5 types of athletic socks compared to barefoot. And the 2 that I've highlighted there, sock 3 and 4, were the ones that demonstrated a significantly increased shock attenuation compared to barefoot walking. So they were measuring basically peak pressure, so the vertical force, the normal force. Cotton socks weren't any different to barefoot. Double layer cotton socks weren't any different to barefoot, and toweling cushion sole socks weren't any different. But the wool cushion and the acrylic cushion did reduce that vertical force. Separately, Bogert and co-workers conducted a field study of 37 military recruits who were marching for 4 consecutive days in Gore-Tex lined military boots. So these are boots that are waterproof, which means water doesn't get in, but similarly, water doesn't get out. So sweat is going to be maintained within the shoe. 2 socks were compared. The first sock was a blend. It was a 50% merino wool, 33% polypropylene blend, and the other sock was a 99% polyprop sock. The extra materials in these socks would have just been kind of like nylon or whatever to make it stretch and last longer. The study was designed to measure the moisture content on the skin surface of the feet, as well as the moisture content retained by the sock. So we had subjective and objective measures here. The subjective results, the recruits rated the wool polypropylene blend sock to be cooler, less damp, and more comfortable, which is interesting because you would think that the polyprop, being more synthetic and more hydrophobic, would have maximized moisture wicking function because it's hydrophobic. And yet these people, these soldiers, rated that their skin was less damp with the wool blend sock. And the objective results, well, the wool blend socks kept the surface of the foot drier than the polypropylene sock. So again, the polyprop didn't mean drier skin. In 2 locations anyway, the top of the foot and the back of the heel, there was no difference in moisture content under the entire plantar surface of the foot. Now, when you think back to that picture where I had the skin and the sock and the arrows going up, if you think about a athletic shoe, modern day athletic shoe with its mesh upper, which is the opposite to what this study used. This study was using a waterproof boot. You know, for the top of the foot especially, it would intuitively be easier for any moisture that gets through the sock to the other side of the sock and into the shoe, then can evacuate the shoe through the mesh upper. But when you flip that picture upside down and you've got like the skin of the plantar metatarsal head, for example, then the moisture, then the sock does something with the moisture. Ideally, there's a moisture gradient, so it moves to the outside of the sock to be evacuated into the shoe. Evacuated into the shoe basically means, you know, there might be some airspace under the arch, for example, because it's non-weight bearing and at certain stages of the gait cycle, but essentially it's getting absorbed by the insole. And so at some point, the insole has absorbed so much moisture that the gradient just isn't there to facilitate that moisture movement. So that's probably why there was no difference at the plantar surface. So potentially socks can work to different degrees for different anatomical locations. And I'm a big proponent of dealing with blister prevention specific to anatomical locations. So the wool blend sock absorbed 3 times the moisture of the polypropylene sock. The authors speculated that the superior moisture storage benefits of the wool blend sock outweighed the wicking capacity of a polyprop sock inside a closed boot where moisture evaporation is compromised. It would just be so interesting to repeat this study with a modern day athletic shoe. So to reduce moisture content on the skin surface, the absorptive capacity of a sock becomes most important when the footwear has resistance to evaporation. So where the moisture can't get out of the shoe, the absorptive capacity, and remember wool is the most absorptive, and second to that is cotton. This becomes important in a sock. Looking at construction, athletic sock manufacturers generally use one of 2 knitted structures, that is terry and simple jersey. Now, this is where things get really complicated, because have a look at these. This is a study by Busan and colleagues. So they looked at 6 weave structures of socks. So what we've got here is simple jersey, double jersey, duffel jersey, and terry jersey. And more specifically, these are the 6. So the single jersey and the terry jersey, they used from 2 different manufacturers. They really got up close and personal in terms of looking at what the arrangement of the terry loops and, you know, all this kind of stuff. It was really, really complicated. But the results essentially are they measured friction and they measured vertical force. So they measured the horizontal force, which is coefficient of friction, and the vertical force, which is like the normal force or pressure. The friction and shock absorption experiments showed that terry jersey socks generate less friction and absorb more energy than other textile structures investigated, provided that the terries are compact, homogeneous, and orientated in the main sliding direction of the foot. So it really makes a difference which way the terry loops are slanting. And they found that in some of the socks, the coefficient of friction was double that when going the opposite way. So when the sliding force was applied in the opposite direction of the terry loops compared to going with the direction. So man, it gets complicated. And just to really compound the complication, this is another really good study. This wasn't specific to socks, but they were looking at thermal and moisture management properties of knitted fabrics. So when you knit a fabric, it has a front side and a back side, and they look different, and therefore their properties are different. And there's just numerous ways to kind of construct fabrics that go into making clothing and socks. So it really does get tricky. So at the end of the day, you can't be blamed for scratching your head and thinking, well, how the hell do socks prevent blisters? Because things are getting kind of complicated. And when we look at how research is conducted and the things that they look for, these are all the things that are, you know, mentioned. Some of these things mean the same thing, some slightly different, but yeah, it really does get complicated in trying to interpret them. And then if we look at wool, because I've been looking a bit closer at wool, we actually stock in the blister prevention stock, we stock a blister wool, which is like a loose packed wool that you kind of grab. It's like hiker's wool, and you just like put it in various parts of your sock. And I've talked to quite a few people about loose packed wool and how this works. And it seems that like merino, the fine wools, they don't work so well. You need a coarser wool for it to be able to work. And when we looked at the coarser wool is the one that has the medulla. So it has the potential to absorb more moisture. Yeah, it's just interesting. I'm not going to say that, you know, things are black and white, because they're not. And when you think about wool, not only do you start with specific micron sizes that have different properties in itself, then the wool is cleaned and washed, so that removes all the lanolin. And then they don't fully dry it. They semi-dry it and they add some oil back in just to make it more usable and manageable. Then it goes through a whole bunch of combs, which straightens it and puts it into slivers. It's spun, and that can be done in different ways. It's weaved into fabric. That can be done in different ways. And there are some other processes like shrink proofing. And then it's plated and combined with other materials to form the final fabric that the sock is made out of. So good luck trying to, you know, say to your patient, oh, this is the best sock. I kind of think it's impossible. But to the best of our understanding, thick is better than thin. I think it's generally regarded that wool has a comfort factor. But the way I educate my patients in terms of choosing a sock, for blister prevention, is just get something that's comfortable and that you're happy with. And there are more honed in and specific ways that we can deal with blisters if you're still getting blisters. So I'd never really expect a sock to be the be all and end all in terms of blister prevention. So I'm sorry to say that we can't really hang our hat on anything in terms of socks. So yeah, it's important to realize that lab studies do not always replicate sock performance in a real life situation, that is during actual physical activity and inside of footwear. A lot of sock research is done in dry conditions just because it's easy to standardize, which doesn't reflect the in-shoe environment. And there's been precious few blister incident studies. The Herring and Ritchie study from the 1990s is really the most significant that we've had. This is just to remind you that, you know, if you think about this as the dorsum of a digit, it sweats, you got the moisture, it interacts with the sock, it evaporates into the shoe, and then hopefully it goes into the outside environment. But it depends on the shoe itself, and it depends on where this is. Like if you flip that picture around and all of a sudden the perspiring skin is the planted forefoot, there's that tiny, it'll be much smaller space between the skin and the sock, because there's the compaction component and, you know, the weight bearing component. Then the sock deals with it. Whatever moisture moves through goes into essentially the insole. So that kind of retards at some point the moisture gradient. But socks don't necessarily just work by one mechanism. So it's not all about potentially reducing the coefficient of friction. And I would suggest that it has very little to do with how this is achieved through moisture management, because the kind of skin that has a low friction level is bone dry. And once you've had your shoes on for a little while, your feet aren't bone dry. Your skin isn't bone dry. It's a little bit damp and clammy. Then if you add a hot day, then if you add your exercising, you've been in those shoes for a long time, yeah, I just can't see that it is all about moisture management and how that affects a lower coefficient of friction. So wrapping up, it is complicated, but we had a quick look at the properties of sock fibres. We've had a quick look at some research on fibre performance and blister incidence. We've had a quick look at the paradox of wool being both hydrophobic and hydrophilic, and how this might be a good combination for a sock material. Why moisture wicking might not be the solitary aim of a sock, and why it's difficult to pinpoint the exact best sock for blister prevention. So if there's any questions, I'll grab them now before we move on to the Q&A.
Okay, so I'm confused as to what.
Me too.
I don't know what sock to recommend. Look, I had an AFL player in recently. He's getting severe blistering under the first MPJ. And yeah, look, he's found that the double socks have helped. He's doing a thin bamboo sock, and then his footy sock on top. Oh,
okay.
Yes, and that's working quite well. And we got onto your patches, the
Engo,
yeah. Applied that to his inner sole, and yeah, he's doing well. But I'm a bit confused now, because bamboo, you're saying, is like cotton.
Well, bamboo, the main thing that we know about bamboo is the drying time. So it holds a lot of moisture. So there's the potential for that to be a bad thing. But we don't know. We don't know. And if something's working for someone, then stick with it. But essentially, I would never hold all my hopes on a sock.
Okay.
I would zero in on that anatomical location and understand how the bone is moving, because blisters are always, it starts with the bone movement. The skin is generally stuck to the in stationary contact with the sock and the insole and the shoe, etc., because of high friction levels, which are relatively inevitable, but the bone is continuing to move back and forth. So that's the value of the Engo patches. They reduce that friction force no matter how much moisture there is, and they will let the sock slide against the Engo patch just for that anatomical location. And that will mean that if this is the skin and this is the bone, as the bone moves, the skin can move with it at an earlier point, and that reduces the magnitude of the individual shear distortions. Yeah.
Okay.
So whether the bamboo and the other sock was a double sock, in that it worked in terms of reducing the friction level, the coefficient of friction, or whether it's just the extra cushioning, who knows?
Okay. Yeah.
Thanks, Carmel.
Yes, thank you.
Good question. All right, let us move on to, I got two questions. One from Jen: the intractables, the people who blister the worst, causing them to pull out of walks they have trained for because of parlors blistering. I don't really know what parlors blistering is, but essentially Jen is asking, what do you do about those people that have done all the right things and have trained, and yet when it comes to the big day, things go pear-shaped and they have to pull out? And Donald asked prevention predictors. So I'm assuming, how do you predict that a prevention is going to work? That's how I'm going to take that. But I'm going to answer both of these questions simultaneously. So the way I think about blister prevention is, people come and see us at one of these three stages. Most of them have done the basic things. So they've optimized shoe fit. Well, at least they've thought about it. Whether they've optimized it, you can have a look and see what you think. They've generally implemented some firm lacing, because loose lacing is not the go. Moisture wicking socks, thick socks, they air their feet out, when they're hiking at every opportunity, and they change out of wet socks. A lot of people think that is what blister prevention is, full stop. So when they come to see you, you have to kind of realize that they feel like they've tried everything, but they probably haven't really. So really nut out what they have tried, and and nut out whether they have maximized those things. Then you'll have a group of people that have gone the next step. So they've generally tried taping, they've tried lubricants, they might have implemented double socks, they might have some cushioned insoles that if they've got plantar blisters, or they might have even tried kind of donut pads. Again, these people think that 1 and 2 is the be-all and end-all of blister prevention. It's certainly, these things can help, but they're relatively general in nature, and not really specific to a blister location. There is a lot more that we can do. So just nut out that they've done all these as best they can, but just know that it's your job really to educate them on what's next. And the next thing are these advanced blister preventions. So the biomechanical interventions, because shear deformation, which is what causes blisters, is initiated by bone movement in the presence of stationary skin. So it's that mismatch of movement, that out of sync movement between skin and bone, that causes the mechanical fatigue within the skin that causes blisters. So we can impact on how that bone moves. As podiatrists, this is what we do every day. So, you know, for the first MPJ, for example, what's making the arch flatten, or why are there higher peak pressures there, and what can you do about it? Toe props they haven't thought of, interdigital wedges, these things can be really great for all sorts of toe blisters. Engo patches are fabulous because they're the easiest thing to implement for long-term friction management that is specific to that anatomical location, because what you don't want is to reduce friction everywhere in the shoe. The foot actually needs friction for traction, and traction gives the foot stability. So where we get blisters, we only need to deal with the friction levels at that area. And that's why I like Engo patches, because they preserve friction elsewhere, therefore maintaining the efficiencies of gait. And gel toe protectors can be really great for toe blisters. So just figure out where your patient is in terms of their thinking of blister prevention and what you can offer in terms of your expertise. When it comes to people preparing for an event, I always tell people that any blister they've ever had before, they should just assume that they're going to get that blister again, and they should implement prevention assuming that this blister is going to happen. It doesn't matter what the circumstances, where it was on the foot, what shoes they were wearing. If they've had a blister on the outside of their little toe and at the back of their heel, and they're about to do a 25K, you know, run for a reason or whatever's going on, or big hike on the long weekend, then just tell them that they need to get the best preventions. They need to research, or you tell them what the best preventions are for these anatomical locations and get them in place. That's the low-hanging fruit. That's just the most basic thing. And if they can deal with those, then chances are things aren't going to go too badly. If you add to that anywhere where they've got callus, that would be great. Basically, calluses and blisters are caused by the same thing, that is repetitive shear deformation. So it's not enough to get rid of the callus. The callus is an indication of repetitive shear deformation. Callus is the chronic manifestation. Blisters are the acute manifestation. So anywhere there's callus, there's going to blister if you increase your activity level all of a sudden. So take care of those areas, implement the best preventions, and that has to be, you know, probably 75%, if not more, of the blister issues that they're going to get. So other than that, if they come and see you, then you can have a good look at their feet and identify any other areas that might be problematic. If they don't have a blister history, if they've never really been as active as they're about to be, then you need to really have a good look at their mechanics and see if there are big joint ranges of motion, tight calf muscles, lifting the heel up, you know, all that kind of stuff. But this isn't to be neglected. It's just, as I said, it's the low-hanging fruit. And if you don't take care of this, then you're just asking for trouble. And following on from that, really, to implement the best of preventions, you've got to think about the anatomically specific area that blisters, because there's different reasons for the repetitive shear deformation, you know, different reasons for what's going on with bone movement and pressure, etc. So if you don't know what these are, then you should join Blister Prevention University, because I tell you what the reasons are for blisters in these areas, the biomechanical reasons, and also the best preventions for them. And if you don't want to do that, then of course you can direct people to my website. There's a bunch of free information on that. Or if you'd like me to kind of guide them through it, the Fix My Foot Blisters Fast course is tailored to this thing exactly. It's like a course for people that are about to embark on something big. They're worried about their potential blister issues, and I tell them all about these anatomically specific locations and the best preventions for them. Other than that, you probably know that I go to ultra marathons where I am treating a lot of blisters. And it is possible to make any blister virtually pain-free if you implement the right treatment. And the key is you've got to implement the preventive strategy, because the prevention is the thing that minimises the shear deformation. If you can minimise the shear deformation, even if there's a blister already there, it means that there's less tearing, there's less worsening of the blister situation, and it can actually start to heal even though they've got to keep walking and running on it, even on weight bearing areas. So for those people that are really, I don't know, blister prone, or they're just the type that bad things happen during an event, then not only do they need to know about all that prevention stuff, which generally, if they're doing it right, will eliminate the issue, then they at least need to implement the prevention during the treatment. Because, when they're in an event, it's hard for them to bring themselves to stop and take their shoe off and have a look. And that's when things can kind of go wrong. So that's it, folks. That's all we're going to talk about with in regard to fibres and moisture wicking, etc. But I'll take any last questions before we head off. No questions? Thanks for joining, guys, by the way.
Well, thank you.
So you got a home visit now, Carmel?
Yeah, I do.
You better get to it.
No.
Yeah, sorry?
There was that blister wool that you were talking about.
Mm.
How does that? So where do you get that from? The blister wool?
Blister wool you can buy from our website. So blister-prevention.com. It's in our shop with the Engo patches. Okay. And you just basically stuff it in your sock. So it's often used around toes. So you just kind of like loop it around the toes, then pop your sock on. It stays in place because it kind of really sticks or melds to the sock. Mm-hmm. And there's very little talk about how it works, but I think it probably absorbs shear more than anything else. So the fibres of the wool, they kind of slide against one another, and that means that there's a little bit earlier movement of the skin in relation to the bone, but potentially it could also reduce pressure, and potentially the oil content in it could also reduce friction levels. So
do you wash that?
No, you don't wash it. It's single use.
Oh, it's a single use. Okay.
Yeah.
Okay. Cool.
I know people who have washed it and they said it doesn't work.
Doesn't work. Yeah.
No.
Yeah. Okay. Cool. Beautiful. Thank you, Rebecca.
No worries. Now, if you're getting heavily into blister management, Carmel, you can also get that kind of all those things wholesale from us. So let us know if you are using blister prevention stuff more and more, and yeah, we can help you out.
Yeah, no, that sounds great. I will. Thank you.
All right. Thanks for joining, everyone. And we shall catch up next Wednesday, first Wednesday of the month. Sorry, not next Wednesday, the next first Wednesday of the month in July. And that'll be just before I head off to Europe. So if you've got any ideas about what you want me to talk about, let me know. Otherwise, I will see you then. And who knows what we'll discuss, but it'll be something. Thanks, everyone.
Fantastic. Thank you so much.
Cheers, Carmel. See you.
Bye.